Researchers say hearing impairment in some people may be related to anemia, a common condition in which there is not enough iron in the blood. In a study of more than 3,000 U.S. adults aged 21 to 90, researchers at Pennsylvania State University found the prevalence of hearing loss among participants overall was 1.6%, compared with 3.4% among those with iron deficiency anemia. The most common forms of hearing loss associated with anemia in the study were sensory neural hearing loss and conductive hearing loss. However, researchers say it's possible that correcting anemia with supplemental iron could improve the conditions. The findings were published in the journal JAMA Otolaryngology, Head and Neck Surgery. Now, a popular Germany-based physician known as Dr. C dispenses health advice on the internet via YouTube and other online platforms, mostly in broken or pidgin English. Her healthcare tips reach a large population of people without access to affordable healthcare in Cameroon and across West Africa.
I want to talk about stroke.
Dr. Susan Njema Awehis, a native of Cameroon, is widely known as Dr. C. She practices in Germany and specializes in internal medicine and cardiology. Dr. Awehis uses short videos to offer information to her fellow Cameroonians on disease prevention, management, and care and posts them on YouTube. She says a colleague encouraged her with the idea to disseminate her knowledge on the internet.
When he approached me, I was like, brilliant idea. I already have lectures in hypertension, lectures in diabetes and pidgin. We could just start. Why don't we start?
The topics covered are mostly done in pidgin English, which is widely spoken in parts of West Africa.
My favorite video is that on antibiotic resistance. Why? It's because antibiotic resistance is something that many people don't know about. It's something that is a silent killer that keeps rising, and none of us know about it.
Dr. C uses the web platform as a way to counter infrastructure bottlenecks in the country where access to doctors and services remains a challenge. According to some statistics, there are fewer than 2 doctors for every 10,000 people. At the Baptist Hospital in Kumba, Dr. Tata Divine says doctors in the country are generally overwhelmed and that he even sees 60 patients a day sometimes. However, he is skeptical about online healthcare.
You really need a medical personnel, a trained doctor, to clerk you, examine, and then maybe do some tests to be able to say, okay, this person is having a kind of chronic typhoid which has perforated his intestines, and that can be an emergency. It's an emergency because it can easily lead to septicemia and many other things set in. And then, so talking about going online to seek for medical attention, it's quote-unquote good, but it can be very harmful too.
Dr. C says there are some hurdles to overcome.
The challenges come as poverty, lack of information, lack of infrastructure, because even if someone in a village is informed about what is going on in their body, they know what they should do, what they shouldn't do. If they need professional care, they will have to leave from that village sometimes to go somewhere else because the infrastructure is not there. And even when that healthcare is in the neighboring urban setting, they might not even have the road.
Dr. C has a web page where she posts health articles. She says her work targets not only people in her native Cameroon, but throughout the region.